Ready? Okay, I think we'll go ahead and get started. Good afternoon. Earlier today, we announced the updated number of COVID-19 cases in Iowa. There are 34 new positive cases today for a total of 179 positive cases in Iowa. Today, we had 397 negative cases for a total of 2,975 negative cases in Iowa. We have 31 hospitalized as of last evening, and tests available for individuals through the State Hygienic Lab is 891. Additionally, the Iowa National Guard is conducting 23 missions today to deliver PPE to 23 counties, and since the start of the week, nearly 100 missions have been completed and critical PPE supplies have been delivered to 53 counties. As I have mentioned throughout the course of the last 2 weeks, and as recently as yesterday in my press conference, we will continue to take additional steps as necessary to further protect the health of Iowans and our economy. Today, I am expanding upon the public health disaster emergency proclamation that is currently in place by extending and expanding retail business closures, suspending elective and non-essential medical and dental procedures, and removing additional legal barriers to ensure a continued strong response to this disaster. Effective at 10 p.m. today, all existing closures, including restaurants and bars, will now be extended another week until April 7th. I am also ordering the closure of additional retail stores through April 7th, including bookstores, clothing and shoe stores, jewelry, luggage, cosmetic, perfume and beauty supply stores, florist, furniture, and home furnishing stores. Effective at 5 p.m. tomorrow through the duration of this disaster, all non-essential or elective surgeries and procedures that can be delayed without undue risk to patients are suspended. All elective dental procedures, including routine hygiene, cosmetic, or orthodontic procedures, are suspended, with the exception of emergency procedures. These actions will help us preserve the personal protection equipment as well as our healthcare workforce. Additionally, to encourage the use of telehealth services to screen and treat individuals who may have the virus, health insurance companies shall reimburse healthcare providers for telehealth visits at the same rate as in-person visits. I am also ordering healthcare facilities, including nursing homes, to engage in enhanced staff health screenings. And at this time, as I said originally, schools in Iowa are recommended to remain closed until April 13th, as previously stated. I said we would reevaluate in 2 weeks, and knowing that we were coming up on that timeline, we did do the evaluation, and at this time recommend that they remain closed until April 13th. We're continuing to monitor and assess the situation daily, and we continue to work with superintendents across the state. Director Lebo will be with us tomorrow to give an update on some of the issues that they've been working with superintendents to make sure that we're providing students what they need throughout this time. These additional steps, along with those we've already taken, are equivalent to the goals of many of the shelter-in-place orders. I understand that these decisions will continue to impact the lives and livelihoods of Iowans. But the more, as I keep saying, the more we do now to mitigate the spread of the virus, the sooner that we will get through this so that life and business can get back to normal. Also earlier today, the United States Department of Labor announced the initial unemployment claims for the week ending March 21st, and it topped 3.28 million nationwide, and that's an increase of more than 3 million from a week before. Here at home, the number of initial claims filed between Sunday, March 15th and Saturday, March 21st was 40,952. More than 10.6 million of unemployment insurance benefits were paid to Iowans in the week ending March 20th. The numbers we're seeing now are unprecedented, but not unexpected. In Iowa and states across the country, we have intentionally dialed some business sectors back as part of our COVID-19 mitigation plans. I know that these decisions have an impact on families and businesses, which is why we have also worked very hard to put in place measures that would assist business owners, individuals, and families who have been directly impacted by the orders. We anticipate more assistance is coming soon with the CARES Act, a significant stimulus bill that was passed by the Senate overnight and will now go to the United States House. The bill would provide direct payments to individuals and families based on income, expand unemployment insurance benefits, and address part-time, self-employed, and those part of the gig economy, and extend benefits after state benefits end, and give small businesses access to nearly $350 billion loan program to cover payroll, rent, and utilities, and help bring employees back that have been laid off. In these uncertain times, we are taking extraordinary measures to preserve our way of life. And this is not a typical economic downturn. And I believe that once COVID-19 is under control, that Iowa will make a strong comeback and again be recognized as a national employment leader. We are continuing to assess all aspects of the situation every day, and we will do whatever necessary to protect the health and safety of Iowans and support the stability of our economy for the long term. And with that, I'd like to ask Iowa Workforce Development Director Beth Townsend to provide some additional information regarding our unemployment claims. Beth?
As the governor indicated, we paid a little over $10.6 million for last week's initial claims. The weekly claims numbers will be reported next Thursday when we start releasing initial claims from this week as well. So every Thursday, DOL will put out numbers that will include both new initial claims and also weekly continuing claims. The majority of the claims that were made this last week were paid within the 7 to 10 days of the initial filing. And the industries which are the most COVID-19 related claims in that time period are as follows. The accommodation and food services industry had over 13,000 claims. Healthcare and social assistance, these are individuals who work in private healthcare facilities, possibly, that were laid off, almost 5,000 claims. Our education services, which include our hourly school employees, 2,600 claims. Other professional and personal services, almost 2,000, and retail, 1,700. Iowa Workforce Development is receiving tens of thousands of calls, and we have 250 staff who are answering those calls every day. We've hired additional temporary staff to assist with the phones, and they will be trained in the next few days to be on the phone starting Monday. We know that there will be long waits from the resulting surge that we've seen in claims, and we ask everyone to be patient and to show us grace. We are certainly here to help. It just may take us a little bit longer to get to you, but we will get to you and we will help. Please look at our website as we continually update the website with questions that are frequently answered, including information regarding this week's unemployment claims. We are watching the stimulus bill very closely that's moving through Congress. It would extend benefits from 26 weeks maximum in Iowa to 39 weeks or an additional 13. Many people who may not qualify for the full 26 weeks because of a lack of wages would nonetheless be eligible for the additional 13 weeks that the stimulus provides. Under the verbiage in the Senate bill that was passed last night, we would also be waiving the minimum amount of wages in order to qualify for unemployment. If you're self-employed, you work for a nonprofit, you're an independent contractor, you would also be eligible for unemployment under the stimulus bill. The stimulus bill allows for proof of income, either using your 2018 tax return or 2019 1099 forms that have been issued to you if you've not yet filed your 2019 tax return. As the governor indicated, there's an additional provision of dollars in the stimulus bill that would provide an additional $600 per week per individual for unemployment claims. This is in addition to your regular unemployment benefit. So for example, if you qualified for unemployment benefits based on your wages and the number of dependents for $400 a week, under the stimulus bill, you would receive $1,000 a week for the unemployment insurance benefit. Should you have any questions, please don't hesitate to reach out. We're happy to help. Thank you.
Thanks, Beth. And with that, we'll open it up to questions.
Today, the president sent governors a letter asking you to rank counties as high risk, medium risk, or low risk. How soon will you get that done? Will that information be public? And will that help determine the deployment of resources?
Yeah, so I haven't had a chance to read the letter. I think it just came just a few minutes ago. I was able to participate in part of the governor's conference call with both the president and the vice president. So really it aligns pretty well with what we're using for metrics for to determine, whether or not we need to issue a shelter in place. So part of the metrics that I laid out the last two press conferences really does give us a sense of maybe where some of the hot spots are across the state. And we're using that information that the Department of Public Health and Dr. Padati have put together. And then especially with supplies and PPE, when that comes in, that's how we're prioritizing the deliveries that need to be made as well. So a lot of that information we're already gathering, and I need to take a look at what he's requiring and then see how that aligns with the way that we're putting it together. Do you have anything to add to that, Sarah? Okay.
Getting a lot of questions about self-employed people and single proprietors not qualifying for this new small business program. Will there be any specific assistance targeted to self-employed and single proprietors?
Well, I think as Director Townsend indicated, that is really addressed in the CARES Act, but if you want to add some specific details to that. But it says, and we worked with our congressional delegation to address that very issue, as we've heard a lot of comments about it also. But
so you're not going to have a state level?
Well, I'm going to...
So the stimulus bill would provide unemployment benefits to the sole proprietors, to the self-employed, to those who are independent contractors, to our nonprofits who do not normally qualify. So essentially, anyone who receives income where you are not taxed for unemployment, you would be eligible to receive the regular unemployment benefit plus the $600 weekly benefit that's being provided in the stimulus.
And Kay, the team, we're going to continue to reassess as we move through this and as we hopefully, continue to bend the curve and we start to look at ways that we can maybe bring some industry back online. What that timeline is, I don't know at this point. But, as we work through some of this and we see the finalized plan that hopefully will get passed by the House tomorrow, and we bring that back in with the team that's been working on putting our packages together, working with the legislature, we'll start to see kind of where some of the gaps are at and maybe what are some things that we need to do additionally, being, fiscally responsible in doing that. We have to also be careful, but, we want to make sure, these are people that are impacted based on decisions that we made at the state level, and we want to make sure that we're doing everything we can in conjunction with our federal partners to get them back up and going and get our economy cranking again.
So we know a lot about what comprises the metrics on that shelter in place that you mentioned. Are you able to say how close we are or how far we are away from meeting some of those metrics, or are we in the middle, or are you able to give like a ballpark on that?
Yeah.
Thank you. I think as described, we're looking at this kind of also on a statewide basis, but also on a community by community basis. And so it really depends on the various characteristics of each individual community in terms of how close or how far away any particular community is at this particular point in time. But as soon as the Department of Health feels like we're at a point where we need to make that recommendation to the governor, we are prepared to do that, and we will do that when the time is right.
Are there any that are close?
No, and it's just, no, and right now we're continuing to monitor that. I get an update every single morning. We reconvene every night at 4:30 to just walk through any of the things that have happened throughout the day. So the thing that I think you need to know is we do have a plan in place if that does happen, and we're ready to go, and we're monitoring it. We're basing it on consistent data points and metrics that they put together. They continue to reevaluate them to see if there's any additional metrics or, factors that need to be a part of those decision points. But we are reevaluating every day, and we'll let Iowans know if we get to a place where we need to do something different.
All right, we'll jump to folks on the phone. First question will be to Kathy Obranovich at Iowa Capital Dispatch.
Yes, thanks, Governor. Can you discuss a little bit what metrics led you to extend the business closure a week at this stage and add some additional business closures, maybe the ones that aren't specifically related to healthcare, like bookstores? Was there something specific in the numbers that made you say, okay, we need to extend this longer?
Yeah, well, so right now, I think we haven't actually made it through the first incubation period, and so we haven't even really been able to gather the data about the decisions that we made early on to see if we have started to bend the curve. I said earlier this week that we are going to continue to see the numbers rise this week. We're also monitoring. We had people return back from home from spring break, and as we've said, if you've traveled outside of the state, we would recommend that you do your self-isolation for 14 days. If you have an employer, you might want to talk to them before going back to work, because a lot of them have put recommendations in place to self-isolate for 14 days. So as we work through this week and next, we'll start to get some of the information, and then we'll continue to reevaluate and see how we can move forward. But at this point, we're not at a place, and I wanted to make sure that we were giving businesses, enough notice, and so that's one of the reasons that we thought we would go ahead and just extend for another week beyond what I originally did. But every day, I need, Iowans and businesses to know that we're reevaluating those metrics and seeing, what they look like and talking about what we need to do next. And that went into the decisions that we made in today's health declaration, the extension of the health declaration.
The next question is to Ron Steele at KWWL.
Good afternoon, Governor. The new cases appear to be increasing daily. Earlier this week, 15, 21, now 34 today. So is that because of the availability of additional testing that's going on right now, or are you more concerned now that community spread is becoming a more significant factor in this?
Well, we are testing more, so that is part of the factor. But remember, we had 34 new cases, but we also had 397 negative cases. So, we've had a significant percentage of them that are also negative. But it's attributed to, I think, part of it is to we are testing more people. Is there anything else that we need to add to that? And then we're working out of that first, right?
Right. That's exactly what I was going
Yeah.
to add. Yep. I think that we anticipated all along, and I think Dr. Padati and the governor and I have been consistent in this messaging that we have anticipated to see our case counts continue to increase this week, and that's why it is so important, if you are feeling ill, even mildly ill, that you stay home.
The next question, Aaron Murphy, Lee Enterprise.
I had two questions, and they are both already asked, actually, so I'll pass on to next.
What a day.
Okay.
We're going to go to Channel 13.
Good afternoon, Governor. A two-parter here. With these new recommendations that you just made this afternoon, what's even left that's not impacted before you get to an official shelter-in-place declaration? And then along with this schools, you mentioned you at this point are not recommending that schools stay closed past your additional April 13th date. But would all of these factors you laid out today give guidance to administrators that they should likely expect another directive from you and recommendation to stay closed longer?
Well, I hate to speculate on that, Dave, so because we are basing those decisions on data, I just wanted to give them, I had said that in 2 weeks I would reevaluate, and I knew that we were coming up upon that, and so wanted to give them some guidance that I didn't feel that we would be at a point where we would change the recommendation that had been made. But we'll continue to look at the metrics, and, the more policies and procedures and that we put in place, our hope is that we can continue to encourage people, if you're sick, stay home, don't go out unless it's necessary. Make sure, especially if you're a vulnerable Iowan or older Iowan with underlying conditions, that you are the ones that are most vulnerable, to make sure that you take the necessary precautions to be safe. And, you're exactly right, and I kind of made that point yesterday when we were talking about the shelter-in-home orders that different states were putting in place. I know right now, even in Minnesota's order that was put in place, that exempts 78% of the jobs in their economy are exempted from the Minnesota governor's shelter-in-place. So, that we have said all along that basically we have put a lot of policies in place to really help prevent the curve, protect our most vulnerable, and make sure that we don't see a surge on our healthcare system. And that's really what's driven the decisions that we've made.
Next question, Iowa Public Radio.
Hi. My question is about the category in these unemployment claims in the healthcare and social assistance category. Can you give a little more explanation what kinds of businesses that includes? And could these be workers who could be quickly rehired or reassigned to help with potential worker shortages?
Well, it's funny you should ask that because that's exactly what we're talking about. We're talking about healthcare workers who work in private facilities, private clinics maybe, who have been laid off because those clinics have been closed. IWD is working with IDPH and DHS. We'd like to host a webinar next Monday to be able to get the news out to those impacted individuals about different volunteer opportunities for them to serve in our healthcare facilities that need staff. We also, DHS is hiring right now, so we want to make sure we get those jobs availability out there. So watch our website. We're going to be hosting a webinar to provide that information, but we sure would like it if those individuals in this industry, you have the licenses, you have the wherewithal and the experience. We really could use you back in our workforce, even if it's just a volunteer. With the addition of the stimulus benefits, you're going to be collecting money for unemployment. And if you have some time and a capacity, we would love you to come and work in our healthcare facilities where we really need you to work.
And then Jim with Perry News.
Thank you, Governor Reynolds. My question has to do with workers in the essential critical infrastructure sectors. I'm wondering whether the Department of Public Health has offered guidance on containment or mitigation within these in companies within these sectors. For example, if what would be the protocol if, say, a positive case cropped up on the factory floor at John Deere or at the packing house at Tyson, for instance?
And I've talked to several of those CEOs and administrators of the different companies and just have really encouraged all of them because they know they are essential workers. They're part of the food supply chain and distribution. And so we're really encouraging employers, and I know this isn't easy sometimes, but to do self-testing before they come into the factories, taking a temperature. If they're sick, stay home, making sure they know that they can stay home if they're sick, making sure that they know if they have the capacity to work from home, that you're allowing them to work from home. So, we've said multiple times too that the Department of Public Health has a Q&A sheet for businesses on their website that would help address some of the questions they may have and some of the procedures that they can put in place to help protect their employees as they qualify as an essential service and really help us in making sure that we can keep our grocery stores stocked with food and to do what's necessary. So we have there's a sheet on the Department of Public Health website, and then and they have reached out to several businesses as well.
We also have guidance.
And OSHA has guidance. Okay, Beth said OSHA also has guidance for them as well on her website.
Rachel at Channel 5.
Hi, Governor. There are reports coming out of Northwestern Hospital in Chicago that they are having internal discussions about considering universal do not resuscitate orders to protect healthcare workers. Is that something you are aware of happening at hospitals here in Iowa?
No, I'm not even aware of what you just said, so no.
Caroline Cummings, KGAN.
Hi, Governor. My question is about, two parts. First, you have reiterated every single news conference about stay home when you're sick, don't go out if necessary, but viewers are reaching out to me with concerns that, the people aren't abiding by that and feel that if they're not sick, that they're allowed to go out and perhaps socialize in small groups in someone else's house and have, small gatherings of parties, and that kind of guidance isn't really sticking. So I'm wondering, if you want to clarify that message or be, is there a more forceful message for Iowans on the staying home front? And then secondly, earlier you mentioned about the metrics that you're using. You don't have all that information to measure really if any of what you're doing right now is actually bending the curve. So if that's the case, what is going into that decision making if you can't even look to the data to show that what you're doing now is having real effects?
Yeah, well, we will, right? Well, first of all, I want to say thank you because you reiterated most of what I've been saying every day. So, Caroline, you're paying attention. So, thank you for doing that. I think we have to be responsible. We are Iowans. I shouldn't have to issue an order to say that you need to be responsible and stay home if you're not sick. And I think the people that are not adhering to it right now, I don't know if issuing an order is going to get them to adhere to it. We all have a responsibility to take care of everyone. And I've said that over and over, and you have a responsibility to especially help our more vulnerable Iowans to make sure that we're not exposing them. And we do that by following the orders that have been put in place. If you have a fever and coughing and having respiratory issues, call your physician. They'll walk through an assessment. They'll decide if you need to come in or further, provide you further information on what you should do. If you are sick, self-isolate. If you have someone in your family that's been sick, stay home. We can do this. And the more that Iowans adhere to what we've been asking them to do, the quicker that we will get through this and we will bend the curve and get things back to normal. We won't see the surge on our hospitals and potentially overwhelm our healthcare system, and we can protect those that are most vulnerable. So, I think sometimes I feel this way, that we've been in this for months, and we really haven't been in this for months. We had our first case March 8th, I think. I'm looking for verification. And so, we learn more every single day. And so, based on the recommendation from the Department of Public Health and Dr. Padati and her team in concert with the CDC and with governors across the state, we've made recommendations. And as we learn more, we continue to make additional recommendations that we believe will keep Iowans safe and also, not crash the economy. We feed the world, and we are, we've got healthcare providers that are standing on the line and first responders, and so we want to make sure that we're doing everything we can to protect them. The metrics that we put in place will help us decide if we need to take additional actions in, where are the hot spots? What do we foresee coming up? Where do we need to allocate the supplies to, as we're prioritizing them? So we know that when we put some of those policies in place, it's we expect them to go up. We're positive test. We're testing more right now, but we believe and hope that next week we'll start to see that come down or stabilize a little bit based on the policies that we put in place. If that doesn't materialize or some other factors come into that, then we'll continue to do what we're doing now, and that's reevaluate every day based on the information we have, and we'll adjust accordingly. Do you have anything to answer that?
2 questions left, and that's going to, second to last is Brian at the Cedar Rapids Gazette.
Thank you, Governor. In Lynn County, public health officials are telling policymakers that the protections in place are not enough to slow the spread of the virus.
PPEs.
Earlier this week, you said that local officials have the authority to make the call for a shelter-at-home order for their communities. And it's something that is strongly being discussed and considered in Lynn and Johnson counties. But there's a lot of confusion about the legality of doing this. Johnson County attorney just advised her community that they don't have the legal authority. And the Attorney General's office, they provide an opinion that hasn't really cleared things up and has left some question marks. So I guess my question is if you can provide any more clarity on what local communities can and can't do have the authority to do as far as a shelter-at-home ruling.
Well, so the first thing that I would say is we've had multiple conversations with the healthcare coalitions in both Johnson and Lynn to look at it from a regional perspective, and continue to provide them the information that, the recommendations that we would make to them to sit down and see if they have additional data that we should take a look at, and to really think about why we would we would even consider a shelter in place. Some of the things that we need to consider is if the like the social distancing or some of the policies we put in place? Are we communicating those in a manner that we should? Are there additional measures that should be taken? We need to look at, the PPE and the workforce capacity and how that is impacted in what we're doing. We're also working with the Attorney General's office and taking a look at the statute. And right now, it appears that they do not have the authority to issue a shelter-in-place order. And so that is why we're reaching out to communities on a daily level to walk through with them the metrics that we're using to help, to talk them through why we don't think it's necessary to issue a shelter-in-place at this point. So I would just ask them to go ahead and continue to reach out to that Department of Public Health or my team. We'll continue to work with the healthcare coalitions in that area. I'm having a meeting later today, and just continue to walk through the metrics and the data that we're using to make decisions so that we're consistent in why we are making the decisions that we're making, and that we're not reactionary, but we're doing it in a manner that we can make sure that we can protect our healthcare workers and those essential workers, and as well as the supply chain. And then we talked about yesterday about dialing it up and dialing it back, and then there's also the enforcement component of it as well. So there's a lot of factors that are going in to making these decisions, and we're more than happy to have those conversations with elected officials or healthcare providers in these communities across the state.
Last question to Beth at KCRG.
Governor, thank you so much for taking my question. One of those metrics that you do take into consideration, as you've mentioned, when you determine turning that dial up to issue a shelter in place, is the percent of hospitalizations for those who have been diagnosed with COVID-19. And as the CDC has said, 20% of those who have that diagnosis often need hospitalization for their care. The good news is 80% often only suffer mild symptoms and can heal at home.
Right.
But in Iowa, according to the data on the IDPH website, which, as I must mention, doesn't capture the most up-to-date, that's not a criticism. I understand some of that data can lag a day or two. I just have to be honest about the nominator and the denominator in the data I'm about to mention. It shows that for Iowans, that hospitalization rate is over 35% for people who are currently hospitalized and discharged and recovering. So it's not 20%, it's 35% or higher. Can you and your team please share with me why it's so high for Iowans?
Yeah, I'll have, and I want to remind you too, the data that we post, it's as of 6 o'clock the day before, and we have made that cutoff time because there's a work that we need to do to make sure that we're accurate in the numbers that we are posting. So we've said all along that the data on the website and the data that I post and I talk about every day is as of 6 o'clock the night before.
Yeah, and thank you for that. I think one of the reasons why you're seeing sort of an outsized hospitalization rate when you use the number of people that are currently hospitalized and the denominator of our positive cases does occur due to the testing and the kind of, we've had our testing criteria has been focused on hospitalized patients. At least that's one of the categories by which people can obtain a test of public health significance at the state hygienic lab. And as we've continued to broaden that testing criteria and those testing categories, we continue to see additional testing of patients who are hospitalized. And so I think that accounts for why the hospitalization rate seems a little bit high. It's because we have had somewhat limited testing in our state to date. And as testing continues to expand, I think that we could expect to see, hopefully we'll see, to be more in that 15 to 20% range of our patients.
Okay. Thank you. Thank you.
Thank you, everyone.